For example, when using the Snellen letter chart to screen a 6-year-old child, you would have the child start by reading the letters on the 20-30 line. If she is able to correctly identify 4 out of the 6 figures, you would quickly move down to the 20-25 line. You would proceed downward in a similar fashion. If, however, from the start the child is unable to identify the letters on the 20-30 line, you would quickly move up to the 20-40 line, and so on and so forth, until the child is able to correctly identify the letters. You would then try moving one line down again to determine the child's acuity. Role-playing and practice will enable you to hone your skills as a screener. Coworkers can provide guidance and correction when necessary. Number 12. Record the smallest line of figures the child can identify. For example, 20/20 right eye, 20/20 left eye, 20/20 both eyes. If the child has not passed, note this on the medical record. Number 13. Repeat the above procedure for the left eye by covering the right eye, and record the results. Number 14. Repeat the procedure with both eyes uncovered, and record the results. Number 15. Any child who has not passed the vision screening should be referred to an eye care professional. Please be sure that when you are discussing vision screening results, whether with the patient or with the parent, that you do not use words such as failed or did not pass, as these have negative connotations. Instead, you may choose to say that further evaluation or follow-up may be needed. Finally, number 16. If a referral is given, it is imperative that the parents understand the importance of the referral and the need for further evaluation and care. This is especially important for CHDP gateway patients who have temporary Medi-Cal only for the month of service and the following month. A referral can be made to either an optometrist or an ophthalmologist, depending on the condition and the type of follow-up that is needed. An optometrist is a person who is trained in optometry, the science or work of examining people's eyes and fitting them with eyeglasses or contact lenses. An ophthalmologist is a doctor who treats diseases of the eye. Remember, it is vital to refer all possible vision problems when a child is still young, school age or younger, to provide early intervention and treatment if needed. According to CHDP Health Assessment Guidelines, any suspected vision problem can be referred when detected either by an approved vision test or a clinical observation. Refer any of the following conditions to the appropriate specialist: a possible vision problem according to history or outward problems, any abnormalities observed by the corneal light reflex, cover test, or ophthalmoscopic exam, a visual result of 20/50 or worse in either eye for children aged 3 to 5 years, a 2-line difference in visual result between the eyes, a visual result of 20/40 or worse in either eye for children aged 6 years or older, and all children who are not testable because of special medical problems or those who are developmentally delayed should be referred to a specialist. Documentation of the child's visual screening result must occur in the following areas. Number 1, the PM160. Number 2, in the child's chart. And number 3, on the appropriate referral form, if a referral is necessary. For the following slides, please refer to the samples included in your training packet. Our first example is a passing vision screening result. The Snellen vision screening, or equivalent, can be found on line 6 in the CHDP assessment section of the PM160. Column A is marked, which indicates that no problem is suspected. The appropriate fee is placed in the fee column, and note that you always include the results in the comments problem section of the PM160, even if they are normal. Sample number 2 is an example of a failed vision screening. On line 6, Snellen or equivalent, follow-up code 5 is placed in column C, because this is a new problem that is suspected, which requires a referral to another examiner. The name and phone number of the specialty provider are written in the appropriate boxes, and the vision results can be found in the Comments Problems section of the PM160. This next example is when the vision result is questionable. On line 6, under column C, Problem Suspected, follow-up code number 2 is entered, which indicates a questionable result, recheck scheduled. Vision results are also documented in the Comments Problems section, along with a reason for the questionable result, which in this case is conjunctivitis. This child may be brought back for one repeat test only. There is no minimum interval between the two tests, and you may bill CHDP for this initial questionable result. When the child from the previous example returns for the vision rescreen, you may bill the appropriate fee once more. Also, it is important to mark the screening procedure recheck box on the bottom right section of the PM160 and to include the date of the initial complete CHDP exam in order to receive reimbursement for this rescreen. While we do expect a few children to be uncooperative and therefore difficult or impossible to screen, if a large number of children from your office or clinic are reported to be uncooperative, it may be wise to consider other environmental and behavioral factors that may contribute to improper vision screening. These may include a lack of provider support, medical staff who are unwilling to change their own behavior or practice, a busy clinic, time constraints, interference from parents during the vision screening procedure, or the physical layout of the clinic. Please consider if any alterations can be made in order to enhance vision screening efforts. When a vision problem is detected or suspected, a referral should be made to the appropriate provider. For those patients who are not eligible for Medi-Cal and are only eligible for CHDP services, a county referral should be made using the PM161 form. A copy of the PM161 has been included in your training packet and can also be downloaded from the CHDP website. The patient or parent will need to take a copy of the PM161 along with the pink copy of the PM160 to the county facility in order to receive follow-up care without being charged. Please reinforce to the patient or the parent the importance of taking these forms to the county facility at the time of service. Here is an example of the PM161 county referral form. It is the CHDP provider's responsibility to provide the patient information, the specialty provider's name and address, to state the condition identified in detail, complete CHDP provider information, and have the parent or guardian sign the consent for release of information. It is the specialty provider's responsibility to complete the bottom portion of the PM161. A copy of the PM161 should be given to the parent or guardian, along with the pink copy of the PM160. Please instruct the parents to bring both the PM160 and the PM161 to the appointment. For those patients that are only eligible for CHDP services, you may refer them to the following LA County facilities utilizing the PM161 referral process: the Long Beach Comprehensive Health Center, located on Chestnut Avenue here in Long Beach, Harbor UCLA Medical Center, located in the city of Torrance, or LA County USC Medical Center in Los Angeles. Please inform the patient or parent to expect a long wait time at these county facilities. Additional vision resources for low-income or uninsured children include the Children's Clinic Eye Clinic, located here in Long Beach. The California Vision Project offers a free eye exam. An application has been included in your training packet in both English and Spanish. You may make additional copies as necessary. The Lions Club Eye Foundation offers vision-related assistance on an individual basis. Infancy offers one free comprehensive eye exam for 6 to 12-month-olds. You can log on to www.infantc.org for a list of local providers who participate in this program. Also, large stores or warehouses may offer lower-cost eye exams and classes. For those patients that already have full-scope Medi-Cal, or for those who are eligible for temporary Medi-Cal through the CHDP Gateway, you may refer them to an appropriate specialty provider who accepts Medi-Cal. Please refer to the CHDP Gateway Referral Directory. For those patients who have temporary Medi-Cal through the CHDP Gateway, please stress the importance of seeing an eye doctor prior to the expiration of temporary Medi-Cal. Remember, the temporary Medi-Cal is only valid for the month of service and the following month. If the patient is under a Medi-Cal managed care plan, please refer within the assigned plan. The provider's responsibility does not end with the referral. Following up with parents is essential to making sure that needed care is received in a timely manner. Maintaining a referral log will enable you to track the status of referrals made. In conclusion, CHDP providers play a critical role in preserving the vision of children. By using screening tests as a part of every well child exam, you may help save the sight of your next patient.